And here started your timer, and here is your question. Right, so if you have read and understood, considering it communication skill station, finally begin.
My name is Dr. Khawar Rahman, one of the surgical candidates in this South City hospital. I am working.
Yes. Yes.
Yes,
of North City's hospital.
Yes, you are talking to Mr. Man.
Mr. Man,
Yes.
I want to
Can you
discuss a
summarize your
case.
case, please?
Yes,
You can continue.
yes, with the
Continue, please.
suspected diagnosis of acute diverticulitis, we gave IV fluids and antibiotic. But today she complained of sudden pain in her left leg. It was so severe, and we did the ECG that show atrial fibrillation and PVCs, and her ABG shows metabolic acidosis hypokalemia. So we decided to do the arterial, after examination, we did the arterial duplex, which show some obstruction in the vessels, and our diagnosis is suspected diagnosis acute ischemia. So in this scenario, we gave IV fluids and she is not improving. So we decided to transfer this case, sir, to your hospital. Are you agree to take this patient to your hospital? You want some advice?
Is it an urgent? Can you send the patient tomorrow morning instead?
Sir, it is arterial duplex, and our clinician revealed that it is cold, paler left lower limb, especially the foot, and all the examination like vascular angle and capillary fill shows that patient limb is very in danger. Her pulse is not palpable even. So her limb is in severe in threat, and if we will not shift this case to you, her limb may be lost. So it is requested to take this case.
Okay. Do you need the cardiology to review because of the atrial fibrillation and the broad preventricular complex that she has on ECG before transfer?
At present, her pulse and BP is normal, and ECG may be showing ECG due to slight imbalance. Yes, of course, we should show this patient to cardiac specialist, but first priority is her limb, and this cardiologist can see this patient in your hospital. So
Okay.
I want to shift this patient first, then the cardiologist will involve in this case.
Okay. What do you think of presumed diagnosis of diverticulitis?
Yes, it is suspected when she came, but after giving IV fluids, abdominal pain is resolved, and I think that it may be due to some mesenteric ischemia because she has atrial fibrillation, and even this mesenteric ischemia is resolving situation. And,
Okay. Any differential diagnosis for the symptoms?
yes, my differential is mesenteric ischemia, and diverticulitis may be, but most likely the mesenteric ischemia.
Okay. Do you want to scan the abdomen first before I transfer?
Sir, abdominal examination can be on abdomen be done or setup because it will take time. I have to call the can be done in your hospital. To some thromboembolism, and she has the history.
Okay, all right.
Her abdomen is soft, and I am examining her, and I don't think that abdomen is has any problem at present.
Okay, which investigation do you want to do for our limb? Imaging investigation for the limb.
I will. We did the ultrasounds. At that time, we do not have time to do the CT angiogram because this patient need urgent intervention for limb. But for abdomen, I will do the CT abdomen.
Okay.
If her
how do you
renal
want to,
function is normal.
okay, how do you want to anticoagulate her?
Yes, I will do the anticoagulate the patient. I will direct her hyperkalemia and metabolic acidosis. I will give IV to this patient. Will be given
Okay.
oxygen support.
Okay.
I will treat.
How do you want to transfer her?
I
Which form of
will.
ambulance do you want to use?
I will arrange a special ambulance where, in which a cardioversion machine is present. Facilities. It also the CPR machine defibrillator will be equipped in this ambulance.
Okay, that's fine. So what do you tell our family that you want to do?
I will inform the family that although the patient was admitted with abdominal pain, but she has a sudden blockage of blood flow to his left his limb is in danger because blood tubes or vessels are blocked and limb can be lost. So we are transferring this patient to the another hospital where vascular consultant who deal this blood tubes handling can. So she need urgent transfer to that vascular surgeon and hospital. I will.
Okay, that's fine. You can transfer the patient, no problem. I'll be expecting now.
Thank you, sir. Thank you.
30 seconds are left. Yes. What he could have improved. Which answer would you want him to reconsider?
In which question, madam?
Yes,
renal failure,
overall, renal failure
Yeah.
as well, but then
Yeah.
anticoagulant. I expected you to tell
potassium
Yeah.
KCl. I will give the KCl
yes.
100 milliequivalent per liter, and if it is 260 milliequivalent level, then I will give 10 milliequivalent per hour in infusion form. This is
Okay.
important. I will correct the metabolic
This is
acidosis.
important, yes, that you mentioned,
Metabolic
but then considering the renal function, which anticoagulant would you give, and then how much dose would be given, and how would you follow the patient? APTT?
I will give.
Yes.
I will give renal failure. I will give injection heparin, unfractionated injection heparin, 5,000 international.
Unfractionated. Yes, this is what you had to tell. Right. And
5,000 international. You would then PTTK will be 45 to 60.
yes.
Seconds.
Right. And then mesenteric ischemia, you did say that you'll do the CT scan. with contrast. But if there is renal function, then you'll do the normal.
MRI angiogram, I will do
Yes.
abdomen ultrasound. I will do-
Yes, you did explain why this cardiologist examination can be done later, because these premature these atrial fibrillation can be because of electrolyte imbalance.
No, I will explain the doctor that consultant that I will show the cardiologist in your hospital, although it is PVCs due to electrolyte imbalance.
Could be,
This
yes.
is the answer.
Yes, yes.
But in spite
Or,
of this, I will show because she has EF.
Atrial fibrillation is there.
fibrillation.
Yes. Good. Thank you.
Yes.